Hi, I'm Dr. Cave, a Stanford and Harvard trained anesthesiologist. And when patients come into an operating room like this one here, they often feel symptoms of anxiety, distress, sometimes freaking out, not being in control. They don't know what to expect, and that's completely at odds with what they want, which is often a peaceful surgery experience. So, I'm going to share with you three powerful techniques to regain your inner peace, no matter how stressful the operating room environment or the surgery environment is, before you fall asleep. Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. Being at peace with yourself before surgery isn't only more comfortable, but it's also safer because it reduces the risk of side effects and bad outcomes from surgery in your recovery period and even side effects from anesthesia. The first step to taking control of your inner state of peace is to recognize that there are inner and outer components. The inner component has three important parts, and you lose your inner peace when you lose your sense of control, your certainty, and your confidence in what you're doing. Control, certainty, and confidence. When we don't have control over these three, we're kind of like a rubber band, where we can be flexible to an extent in stressful scenarios like here in the operating room, but we'll snap right back to where we were before. Maybe it's distressed, in fear, stressed out, because we don't have enough flexibility to maintain our inner composure or our inner peace. So, how do we get control of those three parts? Well, number one is our perceived sense of control. The most powerful way, even in operating rooms. Our brains crave control, and they will spin out of control if they can't control what's going on within the body. They can actually spin into panic attacks, can predispose to PTSD, and do so much more harm because we want that sense of control. To maintain our control is to employ rituals. I don't mean rituals like a song and dance, although those can be very powerful, but rituals can be even easier than that. Just look at what athletes and performers do before big events. They have rituals to help gain control of their inner selves. So in an operating room, for example, that can come in the form of asking your surgery team to play a playlist that you really enjoy, being able to choose your music, maybe sing along with it, hum along with it. Maybe introducing yourself to everyone in the room, getting to know them so that you have some control over your understanding of the room that you're in. Who's going to be with you when you're unconscious? Who's going to be taking care of you in that vulnerable time? Another really powerful ritual comes from biofeedback and how we breathe. Being in touch with our nervous system. You've seen me do this many times when I connect myself to a monitor like this one with all the EKG stickers, and they show how I control my heart rate, how I control my breathing to master my physiology, my lungs, my heart, muscles, etc. This all can be part of a ritual to help us gain control before a stressful situation to begin to control our inner peace. Certainty is number two. Certainty you can have before you ever walk into this room by talking to your doctors, being confident enough in yourself to ask your doctor, your surgeon, your anesthesiologist, the tough questions like what to expect before your surgery. Is this the right surgery for me? Just like control, our brains crave certainty. We want to know what's going to happen to our body. So in the operating room, you might want to know about what medications are going to go in your body. You might want to know what's going to go in your mouth, like this guy here. This is actually a video laryngoscope. It goes in patients' mouths. There's a little video screen here so we can place the breathing tube past your vocal cords. That breathing tube can look something like this here. But if you don't know what's going to happen to your body when you're asleep, it's hard to be certain of what to expect. Like, are you going to have a breathing tube? Are you just going to have a face mask like this and not have a breathing tube past your vocal cords? Is someone going to be holding a mask like this over your mouth while you're asleep under anesthesia? These are just some examples of what you can be more certain of if you ask the right questions of your doctor before you ever come into this room, so you can know how to prepare, what to expect, so your brain doesn't have to make up things to try to be certain. When our brains make up things, we call it confabulation, they can fall into what are called cognitive distortions. This is really dangerous because our brains will try to do fortune telling, like predict the future, or do mind reading, like trying to figure out what others are thinking without actually knowing what they're thinking. or black and white thinking, or all or nothing thinking. These three cognitive distortions are very common in the operating room and can torpedo our self-healing potential. Like the fortune-telling cognitive distortion. If you don't know what to expect after surgery, you might be able to make up or confabulate a story, like, I'm going to wake up in a lot of pain, or I'm not going to be able to walk around after surgery, I don't know how I'm going to feed myself, without actually knowing what the future has. But you can solve that by asking your doctor and being confident in what you ask your surgeon and anesthesiologist, so your brain doesn't have to spin out of control coming up with hypothetical future scenarios. And number 3 is that confidence. The confidence in what you're doing. Are you confident about your decision to have surgery? Are you confident in your plan for recovery? Do you know what you can do and what you can't do after surgery? When patients aren't confident about how much they can move after surgery, they fall into this bad cycle of kinesiophobia, meaning fear of movement. And when we're afraid to move, we predispose our bodies to surgical site infections, pneumonias, blood clots, and other surgical complications, largely coming from our lack of confidence in what we can do with our bodies after surgery. Once again, something we can totally solve by being confident in our ability to ask our surgeon and our other doctors the questions that we need to be healthy in this vulnerable state that we're putting our body through. Control, certainty, and confidence help us attain peace from the inside, but the outside is also important, especially in a room like this that you may have never been in before. And this comes from trust, and building trust with what's in the room and who's in the room. So for example, when you come in this room, if you want to have trust in who's here with you, what the equipment is, you can ask your surgery team to show you the recovery area, the pre-op area, the operating room, show you the lights that'll be there, show you the ventilator, the life support monitors, all the tools that we use. The more that you know your environment, the better you can have trust in that environment being a healing place for you. Even when you're unconscious on the operating room table, that trust that you built up before you fell asleep with the anesthesia plays an important part in how much you can trust your environment to be at peace with what's around you and who is around you. Another powerful way is to ask everyone's name. Who's the tech? Is there a rep in the room? Is there any physician assistant for the surgeon? Does the anesthesiologist have an assistant? Feel confident that you can ask everyone around you what their role is, who they are, so that you can be at peace with the situation that's around you, no matter how stressful it might be. This can help remove the perceived threats in this unknown and potentially scary environment that we find ourselves in before surgery. And the better we can reduce our perceived threats, the more at peace we can be with ourselves. And never forget that you're the consumer as the patient. You have a choice in what operating room, what surgery team you want to work with, in most, maybe not all cases. And you should be fully confident, asking those important questions to build the trust with those who are going to be taking care of you in one of the most vulnerable moments of your life. Lastly is number 3, curiosity. Curiosity is the bridge between attaining our inner state of peace with the outer external sense of peace. Curiosity bridges that gap. It helps us better explore the world around us, even if it's stressful, by helping us ask the right questions in the right ways, so that one, our doctors will answer them respectfully as they should, but also so that we gain the satisfaction, the pleasure, and the peace from asking those questions from a genuine spot of curiosity, of interest, of inspiration. Look, curiosity has 2 flavors. One is curiosity of interest or inspiration, where you just really want to know the answer. And if you can't find the exact right answer, you derive pleasure from the journey to get there. The other flavor of curiosity is called deprivation curiosity. It's where you need to know what's going on. Imagine before a final or a midterm, you need to know the answer to the question. It can be anxiety-provoking. It can be rigid, because if you don't get the right answer, it's going to just spin up your anxiety. It's going to make you feel more distressed. All the stuff that we don't want to feel before you go under anesthesia for your surgery. To better build that trust with the room around us, and to achieve that inner state of peace in coordination with it, we need to ask the right questions coming from the right place. Asking them from fearful places or need to know bases isn't as helpful as genuinely wondering, what's the anesthesia medication going to feel like? What equipment are you going to use? What's going to be in my mouth? Are there side effects? What's it going to feel like when I wake up? Am I going to say something funny? This type of thinking is not only more conducive to your doctor answering them in a way that will satisfy your genuine curiosity, but will also be less stressful for you because you don't have that need to know. It's almost like an addiction when you fall into the need to know basis, because until you get the right answer, you're spinning and spinning, and you don't get the dopamine rush until you get the answer that you want. Compared to the other flavor of curiosity, where dopamine is trickling along the journey as you genuinely, curiously explore what's going on around you and what's happening to your body. The more deprivation curiosity we have, the more likely we are to fall into those cognitive distortions that we talked about earlier that can totally torpedo our surgical recovery, our anesthesia experience, and our safety. The more flexibility we have as we try to gain that inner and outer sense of peace, the better your experience is going to be. The more rigid, the less flexible, the more deprivation, the harder it is to be at peace with ourselves before this transformational experience like surgery. If you or a loved one is having surgery, share this message with them, because you all have more power over your health than you've probably ever been told, even in scary situations like the operating room.